Hello, Dr. Evan here. Today we're going to talk about some incidental findings and what an incidental finding actually is. This is a very common thing to see on your radiology reports, especially on a CT or an MRI. Basically, what this is if a study such as a CT or MRI is ordered for a certain indication, let's say it's for abdominal pain or chest pain or shortness of breath, even back pain, something like that, and the radiologist finds something unrelated, usually a mass or lesion on a different part of the body that has nothing to do with the reason for the exam being ordered. So that is why it's called incidental. There are many different things that would fall into this category, and actually the American College of Radiology and radiologists have gotten together to even come up with guidelines on what to do for a lot of these. For example, the most common ones probably would be lung nodules and thyroid nodules, which basically are little lesions on the thyroid or in the lung when the scan was ordered for something else. So a CT scan for shortness of breath, or a chest CT or a neck CT, maybe for neck pain, and you see something in the thyroid or in the lung. For example, if it's a thyroid nodule, we can look at these guidelines here. And depending upon the size and your age, there's different ways to go about this, whether you do nothing, whether you get an ultrasound to follow it up or not. In thyroid's case, an ultrasound is the best way to look at thyroid nodules. For lung nodules, again, they have extensive guidelines like this. And again, based upon size, if it's what it looks like, solid versus less than solid, or what we call part solid. And then again, how often you should look at it, when you should look at it again, etc. Other examples of common incidental findings would be renal cysts, renal masses, ovarian cysts, adrenal lesions. All of those things would be considered incidental, and those would be the most common ones. So basically that's what an incidental finding is. So if you see that in one of your CT or MRI reports, that's what the radiologist is talking about. He or she has found something they say that's incidental, that was not the reason for the exam, or it will not explain the pain or the problem that the exam was ordered for, but something needs to be done about it, usually a follow-up, or they found it but nothing needs to be done, which happens sometimes as well. Thanks for watching the video. Hopefully this was helpful, and you understand now what an incidental finding is and why they're important.